Hi, my name is Jacoby Owens.
Hello, I'm Jaslyn.
Hi, my name is Jayla Jackson.
Hi, my name is Mallory, and our selected disease was pneumonia.
Cover background causes, how it affects the body, signs and symptoms, immune response, diagnosis, and treatment options.
Pneumonia is a major global health issue and one of the leading causes of morbidity and mortality, particularly in children under 5 and in the elderly. It involves inflammation of lung parenchyma and typically presents with a fever, cough, hypoxemia, and radiographic infiltrates. Sejanese in 2016 highlighted pneumonia as one of the top infectious causes of death worldwide and is classified into several different types, including community-acquired, hospital-acquired, ventilator-associated, and aspiration based on mode of acquisition. Despite medical advances, diagnostic challenges and rising antimicrobial resistance continues to hinder the treatment. According to Jane in 2021, strategies such as vaccination, improved access to healthcare, and better diagnostic tools are essential in reducing disease burden. To better understand how pneumonia develops, it's important to look at the pathogens responsible for causing the disease. Pneumonia is caused by a wide range of pathogens. Bacteria are most common, with the Streptococcus pneumoniae being the primary cause of community-acquired cases. Other notable bacteria include Haemophilus influenzae, Staphylococcus aureus, and Pseudomonas aeruginosa, especially in hospital settings. Viruses such as influenza and RSV are significant, particularly in children under 5 and the elderly. Fungal pneumonia is more prevalent in immunocompromised individuals. These pathogens infect alveoli, causing the inflammation and fluid buildup, which hinders the gas exchange. As noted by Jane in 2021, disease severity is largely influenced by the host's immune response. Now that we've looked into the key pathogens, let's take a closer look at how these infections begin and what factors contribute to the development of pneumonia. Pneumonia develops when pathogens bypass normal respiratory defenses and establish infection in the lungs. Common routes include aspiration of oropharyngeal secretions, inhalation of airborne organisms, or hematogenous spread. Sejanese in 2016 emphasizes that aspiration is especially important for bacterial infections like those caused by S. pneumoniae. Host factors such as immune status, age, chronic illness, and environmental exposures play a huge role in suspectability. Immunocompromised individuals are particularly at risk for infections from pseudomonas and fungal pathogens. Thus, pneumonia's etiology reflects both microbial invasion and host defense capacity.
Now that we've discussed the causes of pneumonia, let's take a closer look at how the disease affects the body, starting with its physiology.
For starters, the study of physiology examines how the body and its systems typically operate. Physiology helps us understand how different organs work together to maintain health. When pneumonia occurs, this respiratory infection interferes with the lungs' natural physiology. According to the World Health Organization, the lungs are made up of small sacs called alveoli, which fill with air when a healthy person breathes. When an individual has pneumonia, the alveoli are filled with pus and fluid. The buildup in alveoli prevents oxygen from reaching the blood and carbon dioxide from being expelled. This fluid accumulation restricts gas exchange, making it more difficult for carbon dioxide to be expelled from the body and oxygen from entering the bloodstream. The body thus gets less oxygen, which, if left untreated, can cause exhaustion, respiratory problems, and even more serious issues. Therefore, pneumonia just doesn't affect the lungs structurally. It interferes with their vital physiological role in keeping the body oxygenated and functioning properly.
With a better understanding of how pneumonia affects the body on a physiological level, we can now examine the signs and symptoms that are typically present in infected individuals.
MP typically causes a gradual onset of symptoms that can last from several days to weeks. The most prominent symptom is a persistent dry, non-productive cough, which often sticks around even after the symptoms begin to improve. Many people also experience a sore throat early on, along with mild chest tightness or discomfort. They may feel fatigued or weak, often more than expected from the severity of the illness. Headaches are common, especially in the early stages. A low-grade fever and chills may be present but are usually less severe than in other types of bacterial pneumonia. Patients frequently describe feeling like they have a lingering cold or flu that seems to never improve. Unlike more severe pneumonias, people with MP are typically not bedridden and can continue with daily activities, which is why it's often called walking pneumonia. Symptoms tend to be more subtle but persistent, which can also lead to a delayed medical evaluation. Case study example. Let's consider a 50-year-old female patient from North Augusta, South Carolina. She begins feeling tired and notices a persistent dry cough that doesn't go away. She assumes it's just a cold or a mild flu, but the symptoms don't improve. Along with the cough, she experiences mild chest discomfort, sore throat, and a sense of fatigue that feels worse than what the illness should cause. She also has a low-grade fever and some chills, but doesn't feel sick enough to stay in the bed. Over time, the cough becomes more bothersome, and she feels more worn out than usual. This is a classic example of walking pneumonia, caused by MP, where symptoms persist despite appearing mild. For treatment, doctors usually prescribe antibiotics that target atypical bacteria. The most commonly prescribed is Zyrtec. In addition to antibiotics, supportive care is important. Patients should get plenty of rest and stay hydrated. Tylenol or ibuprofen can also help with fever and body aches. But if the cough is disrupting sleep, a coughing suppressant may be useful. For more severe cases, or if breathing is an issue, oxygen therapy may be used to help open the airways. In rare cases, doctors may also prescribe steroids to reduce inflammation in the lungs.
To understand how Mycoplasma pneumoniae causes disease and why it's resistant to certain treatments, we need to look at a few key microbiology concepts. First is the structure of bacterial cell walls. Most bacteria have a rigid cell wall made of peptidoglycan, which is the target of antibiotics like penicillin. But M. pneumoniae lacks a cell wall entirely. This unique feature makes it naturally resistant to beta-lactam antibiotics and helps classify it as an atypical bacterium. Second is the concept of host-pathogen interaction. M. pneumoniae attaches to cells lining the respiratory tract using a specialized protein called P1 adhesion. This allows the bacteria to stick tightly to host tissues, interfere with normal cellular functions like mucus clearance, and avoid being flushed out, helping it establish and maintain infection. And finally, we need to understand how antibiotics work. Since M. pneumoniae doesn't have a cell wall, drugs that target peptidoglycan synthesis like penicillin are ineffective. Instead, antibiotics such as macrolides or tetracyclines are used, which interfere with protein synthesis or DNA replication, making knowledge of antibiotic mechanisms essential for proper treatment. Through researching Mycoplasma pneumoniae, we also learned some interesting and new microbiological concepts. One of the most surprising was the role of sterols in bacterial membranes. Most bacteria don't use sterols like cholesterol, but M. pneumoniae does, making its membrane more similar to that of human cells. This rare trait helps maintain its structure and survival, especially since it doesn't have a cell wall. Another new concept was how autoimmune complications can be linked to bacterial infections. In some cases, M. pneumoniae triggers the immune system to mistakenly attack the body's own tissues. This happens through a process called molecular mimicry and can lead to symptoms beyond the lungs, like skin rashes or neurological issues. Lastly, we learned about the importance of atypical pathogens in respiratory illness. M. pneumoniae can cause pneumonia in young and otherwise healthy individuals, but it often presents with mild or nonspecific symptoms. Because of this, it's commonly underdiagnosed, which shows how important it is to understand and recognize atypical infections.
Thank you for viewing our presentation. Let us know if you have any questions.